The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we have a very special program planned for you. We're going to be talking with Dennis Nyland, and Dennis is the State Mental Health Ombudsman. You might not even know what an ombudsman is, but it's a person who's an advocate and a person who tries to help other folks that need that kind of assistance with the mental health situations. We have a lot to tell you, so come on back.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Hello everyone, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and today, as I said, we have a very special show planned. We're going to be talking about the mental health ombudsman in our state, but mental health in general. Very important that we are honest and we get things out on the table and make any stigma go away that doesn't need to be there, because we all have situations we may need help with at some time or another. Dennis Nyland, you are the State Mental Health Ombudsman. Welcome.
Thank you very much.
So glad to have you back. It's been a bit.
It's been a while.
Yeah. So why don't we start by you just sort of talking a little bit about who you are and what you do, and again, that troublesome ombudsman word. Could we just sort of talk about that a little bit and make sure we all understand?
We definitely can do that, yeah. Okay. So I'm Dennis Nyland. Grew up in Helena, in Montana. Went to the military shortly after high school. Was in the U.S. The submarine force. Did that for almost 9 years. Went around the world, enjoyed that. Had my wife with me and our kids, and got out of the military and came back to Helena. I love Montana and wanted to come back. So when I got back to Montana, I actually started just doing whatever jobs, trying to figure out what I wanted to do.
Sure.
But then got into law enforcement. Mm-hmm. I was with the Lewis Clark County Sheriff's Office. I went through the ranks, deputy, and then my goal was to be an investigator. So I definitely worked towards that and got to my goal. Mm-hmm. Did different cases, main crime cases and such. And then while I was in law enforcement, I actually sheriff heard of a program called CIT, Crisis Intervention Team Training. It's a Memphis model. It's about de-escalation and how to de-escalate. And for first responders, typically for law enforcement, but it could be, but then it spreads out to all first responders. We're the ones that are going to be there on scene when that crisis occurs. So started working with that, actually got that, going to Memphis, learned about it. We came back, a group of us, and we actually started CIT in 2005 and actually had the first CIT Academy in Montana.
And that's extremely mental health driven. I mean, right? You're being able to learn things that maybe you're not learning in police school or whatever it's called, but it's a way of bringing a perspective and a reference to these folks.
Yeah, you know, people say you're in law enforcement. How is that with mental health? And quite honestly,
how is it not?
They intertwine with each other. I mean, you're there when people are in crisis, so having those skills of knowing mental health, knowing how that works is like a big plus. So, I mean, it's 100% being a law enforcement and doing that. It worked out great. Got out of got out of law enforcement when I was done with my career with that, and kind of figure, what am I going to do next? And I saw this opportunity to be for the Mental Health Ombudsman's office, and sure enough, I went there, and I've been doing it for 8.5 years now, enjoying it, love every minute of it.
Well, and I just have to say again, your experience is just so extensive in terms of giving you context to what mental health ombudsmen do.
Exactly right.
Right.
And I mean, I guess I could explain to you what is an ombudsman.
Right.
An ombudsman, it came from Sweden. It was 1809. Swedish had their monarchy. So you had an individual that was a liaison between the citizens and the king.
Oh, okay.
So that's where the concept came from. And then it went to Canada, and I think then the United States. So basically, I'm a liaison between the citizens and the mental health system, really, is what the mental health ombudsman would be. You also have senior long-term care ombudsman. They help with the assisted living and homes. And then you also have the child and family ombudsman, which deals with like the CPS system and helps with try to resolve those issues. So we have 3 sets in Montana, but that's what I do as the ombudsman. It's basically, they called it a grievance handler, or I'm trying to think of some other stuff they call it. But yeah, basically you're a delegate or you're that liaison.
Well, and I think it's, today's world is so complicated, and medical and mental health things are so complicated that it's nice to have a liaison, a person that can help you walk through some of that stuff so that you understand.
Yeah, of course. Yes. Yeah, I mean, and you talked about, at the beginning of this, you said we're an advocate. We are. Mm-hmm. We advocate for individuals to be self-advocates, really.
Yep.
I cannot, my office, I don't have enough staff to be able to go and help someone, in a court proceedings or in their hometown, but we want them to self-advocate for themselves and to give them those resources.
Well, right, because the empowerment that brings to a person, and I bet you have all kinds of sort of suggestions about, can this person help you, can that person be with you, that sort of thing. So even if you can't be there, you're helping that person figure out their options.
That's exactly right. Yep, we're there to, like you said, I love how you said it, empowered them to be able to help themselves, but to also help them get through the system too, because it's a tough system.
It is, and so much is technical anymore, and some of our folks that we work with aren't savvy in those areas, may not have technical equipment, so they can't get on and look things up, that sort of thing. Exactly. It's nice to have, that advocate who can give you options. Suggest options for you.
That's exactly right.
So that you can move on in your own capacity. I think it's wonderful.
I'm there to be the help, give you the resources you need. If you need someone's advocacy, then I can give them those numbers or those individuals that can actually be there to help them through the process if they need it.
Super. Well, folks, we have a lot more to talk about. Dennis is a wealth of information, and we want to make sure that you leave the program today with whatever contact numbers or info that you need. So don't go anywhere. Stay with us.
Respite,
It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Hello everyone, welcome back to Aging Horizons. We're here with Dennis Nyland today, and Dennis is the State Mental Health Ombudsman and just bringing us lots of information and good resources regarding the systems that he works with. So Dennis, speaking of systems that you work with, what's the sort of process? What do you do? How do you sort of guide folks or give them information? I mean, what's a day like typically for you?
Yeah, and each day it's almost
there isn't typical.
Yes,
Yeah.
in my law enforcement days, I remember I go to my job. I didn't know what I was going to have that day. It's the same thing with this job, which I like. I like that being ready for anything, right? So a typical day. Well, let me kind of go back with what I do as the ombudsman. So as the ombudsman, like I said, if someone's looking for a mental health resource, like an organization or a provider or a facility, they can call my office. With that, if it's like in a bigger city, I'm going to give them a list of providers. I'm not going to give them one provider. I'm going to let them decide who they want to go to. Right. Same thing for facility or organizations. So that's the first piece. The second piece, the ombudsman piece, that liaison, is if they have an issue, concern, or a complaint with the mental health system, they can call my office. And what we do is I listen to what they have to say. That could be 5 minutes. It could be a half hour. Yeah. There's been times I've been on the phone for an hour and a half. Sure. And quite honestly, it seems like a lot of times people are calling and they've called all these other places and everything, and we're like their last resort.
Oh, yeah.
And they feel like they can't get anywhere. Yeah. But I just listen. That's a big piece of communication, right, is active listening. I listen to them. And I've been on there and given the same information, maybe stuff they've already tried and it didn't work. And they said, you know what? I just appreciate your listening to me and hearing me.
Yeah,
so.
Is that you're there and valuing and vindicating whatever they're saying. And I want to also mention too, Dennis, this is confidential, right? You don't talk about these sorts of things with anybody. If someone called up and said, did so-and-so call you? If they had a complaint or something like that?
Yeah, 100% confidential. If when you talk to us, we let them know that whatever's said here. Matter of fact, if they want us to call or talk to whatever issue they have with a provider or a facility or whatever it is, or a person, we ask them, what would you like us to do? This is what we can offer. What would you like us to do? And they'll let us know what they want us to do and what they want us to share. So we have it's a two-way.
Yeah.
You tell me what you want, and I'll be that.
And I know that in the long-term care ombudsman program, it's sometimes hard for people to make complaints because they're afraid. that there might be retaliation or something. And I imagine that could happen with callers for you too, is maybe they have a provider they have a complaint about or something like that, and they're afraid of that retaliation. But the bottom line is it's confidential, and you ask what they want, how they want it to be proceeded with.
Exactly, and as we know, every side, there's two sides of the story, right?
Yeah, there is.
And so I get all their information. If they want us to proceed, I'm going to let them know step by step what the next steps are. Say they need to talk to someone else. Say they talk to us and we're not really the right fit for what they need, and they need another agency or another organization. I actually will say, let me go and make a phone call for you. I will let them know you're going to be calling. I make sure I get a phone number, a contact.
A person, a warm contact, yep.
Because that's a lot of the frustrations is they'll call, they get on, they get stuck on hold or whatever it is. So,
well, and also you tend to have to talk to, especially when you have an issue, talk with maybe several different people, and you don't always get their name, or who you just don't remember who you're talking to sometimes.
That's exactly right.
And so it is again very. To me, that's very respectful that a person gets a name and a contact to call, because, as you said, it's probably their last resort.
And yes, and because they're frustrated, I want them to know if you call and it's not working out, or if you can't get a hold of them, call my office back. I'll make sure you get connected so that you can get this resolved. The only way it's going to get resolved is have that communication, either between me and the individual, or them and the agency or the organization or whoever we're trying to get them connected to.
Right. Now, and I can't remember, I know we've talked about it before, you have what, a couple of staff or one staff person?
So we have me and a part-time person, so 1.5
Dennis.
FTE. So, and we do.
But you do the best you can.
That's exactly right. Yeah. And she does an amazing job. She works on all the resources. She's keeping that updated, and then she's taking the calls just like I am. And so it could be tough, but we're doing the best we can.
Yeah, and I think that people often in crisis just appreciate anyone that will listen and try to guide them in the right direction. I so believe in the no wrong door suggestion of government, and it sounds like that's exactly where you're at as well. And so people should feel like it's a totally okay thing to give your office a call. If it's a fit and you can guide them in any way or give them information, you will. If not, you'll pass them to another person who might be better for that.
That's exactly what that's the goal.
Okay.
I mean, we'll help them. If it's not even have to do with mental health, it's just an issue they're having, we're going to give them the resources they need to be able to get that problem solved.
And I know that oftentimes it can be difficult to find a state number in a phone book, and that's, well, if you even have a phone book anymore.
Exactly. Yes.
So it's nice to know, and I'm assuming you have a web presence.
I do, yep. And actually we just revamped our website, so it's a little bit nicer looking, I guess, and a little bit more friendlier. So go out there. They can. We have a lot of our resources on there, and always you can call us if you can't find something. You can always get a hold of us.
Okay. Well, folks, again, this is some awfully good information, and information that you want. Maybe even if you don't need it right this minute, maybe you want to write it down because you might need it later. We have a whole lot more to talk about, and we want you to hear everything we have to say. So come on back.
Can you say Ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Hi everyone, welcome back to Aging Horizons. We're here with Dennis Nyland, who's the State Mental Health Ombudsman. And Dennis, you know, we're talking about sort of some of the things that you do on a typical basis. What kind of calls are you getting regularly, or is there even a regular call?
Yeah, I mean, I would say I can give you like the top three, the type of calls I would get. You know, it's access to services. I mean, and we are in the times right now.
People are really.
We don't have the services,
right.
or we don't have the staffing. We have a staffing shortage throughout the United States, right? And Montana is no different.
Right.
We're more rural, right?
Right.
And so you know, they're having a hard time getting people in. People have to wait a long time sometimes to even get into a mental health facility or a provider.
Even if they'll take you because they have room.
That's exactly right. And what do we do about that?
Yeah,
I mean,
exactly.
and so that's a big one. The availability of services, like so you got the access to them because of being a rural Montana. Thank goodness. If you want to say anything good about COVID, you know, telehealth and that's actually, you know, with the Medicaid and all that stuff, CMS system, they're able to allow that now under the under their guidelines.
And I have to say they really stepped up. I thought CMS really stepped up and made that possible, because I know I've used it many times over the last 3 years and I like it a lot. Telemedicine.
Yes, and I mean, you're looking at these, like Eastern Montana is very rural, and that is like their lifesaver, and I mean, that's the big one. And then like the legal and criminal justice, I will just say the biggest calls I've had probably recently in the last 6 to 8 months is, as we know, we have nursing homes and places that are shutting down because of staffing shortages, right? So we're getting calls about what do we do with our individuals. You know, they do have some mental health issues or concerns, and what can we do? And so it comes to my office, but it's like,
but that's only sort of half your bailiwick in a way.
That's exactly right.
I gotcha. Okay.
Give them the resources for the mental health piece.
Right.
And then I talk with senior long-term care, and they are. I mean, it's an issue that they're dealing with, right?
Yes,
and so
indeed.
we try to work together. So that collaboration is what is good.
Very important.
Right. So, and then I kind of talked about how do we help people? So we have 4 areas basically. 3 is really what we do the most. It's the coaching, or just give information about the mental health system or mental health resources, or we have refer people. So what I mean by referral, we connect them with wherever that resource is. We don't do an actual referral, but we just say, these are the people you can get a hold of.
Yeah.
And then informal coaching. Like I said, I get calls and it ends up not even being a mental health type thing, but we're there. You got a hold of us, you're talking to us, which is what frustrations are out there also. I can actually talk to a real person, not talk to a computer or push this button number.
Dennis, that's good to hear.
So we do that. And then, as an ombudsman, you can do investigations. It's really not an investigation. It's really, if it's so bad, I will contact the certain agencies.
Right, and you'll get law enforcement involved.
Yeah, law enforcement, or like Board of Visitors. If there's a mental health facility or a provider that's having an issue, we can get a hold of them. They can deal with it because that's their purview. Now that Board of Visitors, we haven't talked about that. Could we just very briefly, could you explain how that fits into this? Yeah, so it's the Mental Disabilities Board of Visitors. Okay. Sounds like it's like a tourist thing. Yeah, it's not. It's not. No Ferris wheels there. No, they're basically, the Montana State Hospital, they have 2 staff there, a lawyer and an individual, an advocate over there. They help with the patients. And they basically do the site inspections. They have standards so the oversight. Yeah, oversight. Well, not. Okay. Yeah, they're not like licensing. Right. They basically have standards to say, how can you run your facility to make sure that the individuals, the clients, are getting the correct care, and that's all they do. They're just making sure, So a little more people-centered. That's exactly right. And and they have a website out there also too. So, and I think the big thing We get about 500 to 600 calls a year. Numbers are the last couple of years been a little funky because of everything going on. But that's about the average, which doesn't seem like a whole lot. But with 1.5 FTE office, that's quite a few.
And you're looking at follow up with those cases. It's not just that phone call.
That's exactly right.
It's also the work that you do. Well, that sounds fun.
Yep.
That sounds like a fun day for you. But before we go, because we just have a couple of minutes left, I wanted to talk about there's a project I heard you guys are working on that I really wanted to talk about. Why don't you tell us about that?
Yeah, so it's called Safer Communities Montana. So I'm very much involved in suicide prevention and multiple. You had Carl Roston.
We have Carl Roston, one of our faves.
And so
he's a good guy.
Worked with him a lot over the years. But we have a thing. It's called Safer Communities Montana. It's basically to educate communities. Right now, it's in Lewis Clark County, Jefferson County, and Broadwater. But we're looking at hopefully to spread it out. If it's a pilot program, it's been about 2 years now, and basically to educate people on lethal means. So, So what is lethal means? I mean, it could be a firearm, it could be medications, it could be a bridge or whatever for suicide prevention, right? So we talk about what is the lethal means. So, for example, medications. How can we make sure that we can get rid of those extra ones? With firearms, we provide gun locks, we provide materials, resources for people to help them. Gun locks. I say gun locks, trigger locks.
Sure.
Not just the cable ones.
Sure.
Safes. Talk about the safes, just to make it. If you have a firearm or if you have medication laying out there, how can you make sure that it's safely stored so that people don't use that as the means?
Yeah, and I love the name Safer Communities because it's very sweet and short and to the point. Just get that information out there. I think there's people that don't realize maybe that's even something they should do, or they would have done it long ago. Put a gun lock on or clear out their medicine cabinet. I think it's just sometimes we get so busy with our lives. Our daily lives that we forget about things like that, but that is most definitely one of our favorite projects with Carl, and so glad to hear that you're also working on that.
Thank you.
Well, Dennis, it was great having you here today. I'm so glad when you are able to come and see us and give us just an update on what's going on in your world, and just thanks a lot for all you do for the state of Montana.
It's a pleasure. Thank you very much. Appreciate it.
And folks, remember, give a call. There's no stigma. It's confidential, and you deserve help if you need it. For Aging Horizons, I'm Kimmy Everman.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.